Welcome everyone to this research webinar hosted by Egg Farmers of Canada. We have people from across the country joining us today, and we're so delighted that you can be with us. My name is Karen Summerfield, and I am the Research and Knowledge Mobilization Officer at Egg Farmers of Canada, and I will be facilitating today's webinar with Dr. Dominik Alexander. We're going to jump into Dr. Alexander's presentation very soon, but first I wanted to note the Q&A feature of this webinar. Now you'll notice there's a chat bubble icon up at the top of your screen. It's the icon that's the second from the left. If you have any questions for our presenters throughout the webinar, please type in your questions and our speakers will be able to address these at the end of the presentation. If you're having any technical difficulties, please let us know using the chat box as well, and we'll do our best to assist you. Our speakers today include Dr. Dominik Alexander, Principal Epidemiologist with EPISTAT Institute, who will be speaking to us about the link between eggs and heart health. Following Dominik's presentation, we'll hear from Kim Kessler, a registered dietitian and EFC's nutrition officer. She will talk about what this research means for us on a practical level. We'll have time for questions and answers at the end, and we'll be wrapping up in an hour by 1 p.m. Eastern Daylight Time. To kick things off, I'd like to introduce Dominik Alexander. Dr. Alexander is the Principal Epidemiologist with EPISTAT Institute based in Ann Arbor, Michigan. He has extensive experience in health research methodology, meta-analysis, and disease causation. His work has covered a wide range of research, and Dr. Alexander has extensive experience in nutritional epidemiology. He has conducted meta-analyses of dietary and nutritional factors, which has included studies of dietary patterns around meat and fat intake, dairy and egg consumption, breakfast eating, and multivitamin and mineral supplements. We're very excited that he's here to present to us today on some of his latest research on egg consumption and heart health. So, Dominik, take it away. Dominik, go ahead.
Yes, thank you so much for the introduction, and it's a pleasure to be able to share my research with you all this morning, or I guess maybe this afternoon, wherever you are. I am currently on the West Coast here today. Hopefully you can hear me all right through the microphone. So yes, I'm going to talk about our methodological process and our findings for the epidemiology of egg consumption and risk of coronary heart disease and stroke, our meta-analysis assessment. So this was published in 2016 in the Journal of the American College of Nutrition. And just to cut to the chase, and then I'll explain how and why we came up with our results. Overall, we found that summary associations, and summary associations mean that this is a weighted average. So this is a meta-analysis technique. And so we're weighing the results from published studies and in the peer-reviewed literature to come up with the best estimates of risk based on a large body of evidence. So based on that, our summary associations indicated that up to 1 egg daily may be associated with a reduced risk of total stroke, more precisely a 12% reduced risk of stroke. Now, when it came to coronary heart disease, we found that summary associations did not show a clear association between egg intake and risk of coronary heart disease, whether increased or decreased risk, but we did find some promising findings among women, which I'll share with you shortly. Okay, so as indicated in the introduction, my primary areas of expertise really involve meta-analysis methodology, systematic reviews, and weight of evidence assessments, really taking a large and systematic look at a body of literature to make an informed decision, and that leads up to disease causation assessments, which is something that I specialize in. So I'm actually a National Cancer Institute trained epidemiologist. However, my expertise has evolved more into the systematic methodology approach. And given that, I'm able to apply my findings to a wide variety of different exposure and outcome scenarios, whether it's from surgical outcomes to nutrition and diet to cancer to cardiovascular disease to body weight and so on. So with that in mind, I was asked to take a look at the epidemiology and systematically evaluate it in the context of egg consumption and risk of cardiovascular disease. So I don't hold a degree in nutrition of any sort, but I am a methodological epidemiologist. So what I sought out to do was to understand a little bit about the background of egg consumption. And I came into this with maybe perhaps a kind of somewhat of a naive notion or perception of eggs and heart health, like many people who aren't versed in this field do. And so the first thing that I did was take a look at the background. And I know that eggs are a common source of dietary cholesterol. And I know that historically there have been some recommendations, perhaps not so much in terms of scientific recommendations, but there have been recommendations based on variable levels of evidence regarding dietary cholesterol. But I also know that, again, as a methodological epidemiologist, people consume eggs as a whole food. And that's what's important to me, looking at the actual consumption of eggs, what people are really doing in their daily lives, and looking at eggs from the perspective of a nutrient-dense whole food that have a plethora of health benefit constituents within them. Okay. Now, moving on and developing some more background, and I was aware of this as well as someone who is a practitioner in nutritional epidemiology, that the dietary guidelines for Americans said that cholesterol is not a nutrient of concern for overconsumption. American College of Cardiology, American Heart Association Task Force. There's insufficient evidence to determine whether lowering dietary cholesterol reduces LDL cholesterol. European guidelines on cardiovascular disease prevention and clinical practice had no specific guidelines on dietary cholesterol and said, well, maybe the greater concern is the fatty acid composition of the diet. So I think when it comes to cholesterol, and looking back historically and where we are now, there's been a changing scientific landscape, and which is common, and I think more common today than it has been in the past. I think there's some more transparency in science. There's some more dialogue. There's obviously controversy and confusion, but I think there's more awareness of really what does the evidence tell us. So that led into really what it is that we did. And so we know that cholesterol is associated with cardiovascular disease risk. We know that eggs are a source of dietary cholesterol, but we also know now that dietary cholesterol was not really considered a nutrient of concern. And again, I'm interested in the consumption of eggs as a whole food. And so that's what I sought out to evaluate. And in the context of the largest burden of disease in North America, which is cardiovascular disease, focusing on coronary heart disease and stroke. So what we did was conduct a quantitative meta-analysis. And again, many of you, I'm sure, are familiar with meta-analysis and meta-analysis methodology. For those of you who are not, it's a systematic quantitative or analytical technique where we combine data from published peer-reviewed sources, all of the studies out there, to combine the data into kind of one large study to make an informed decision on a body of literature. So we can estimate risk across the body of evidence to estimate the association between egg consumption and our outcomes, coronary heart disease and stroke. We're able to look at different patterns of risk by intake levels. We're able to look at variable patterns of risk by different subgroups, whether it's by gender or study country. And then individually, we're able to look at the influence of individual studies to see if some studies pull more weight or have more influence on our overall findings, and why such studies may provide greater influence or less influence. Okay, so we followed the PRISMA guidelines. So this is the preferred reporting items for systematic reviews and meta-analysis. So this is a very standardized guideline for conducting systematic reviews. It really involves a transparent methodological process, and that's what's really key when performing a meta-analysis. So we conducted a broad literature search to really identify all of the available studies, the epidemiologic studies on egg intake and cardiovascular disease. There were a few few studies that specifically look at cardiovascular disease. So we really focused on coronary heart disease and stroke. So we had numerous search term variations for the combinations of these exposure and endpoints. We also looked at individual studies to see if we could identify more studies from looking at their bibliography and so on. And at the end of the day, we included prospective studies. Now, we did that and focused on those only because we are concerned with more of a direct cause and effect relationship. So we're identifying prospective studies that ascertain information on consumption of eggs prior to the occurrence or the outcome of disease. By virtue of that, we excluded retrospective study designs, case control studies, and prevalence designs such as cross-sectional studies. In nutritional epidemiology, the large majority of the meta-analysis only focus on the prospective studies that are less influenced by methodological bias. So that's what we did. Now, prior to the results, we started to review the studies. We have to synthesize the body of literature. We identify the qualitative and quantitative information and start pulling out that type of data that will be useful for our meta-analysis. So looking at the body of literature as it started coming in, we saw many differences in intake reference groups, meaning there's different level of consumptions, which is to be expected on such ubiquitous dietary exposure such as egg intake, and it varies by culture, varies by many different things. And so we had to sort through the different categories of intake to try and come up with our dose response analyses. Some studies included participants with prevalent cardiovascular conditions, so we excluded those populations. We did find some unique study populations as well, like a study of Australian Aborigines that evaluated egg intake, and we did not include that because it compromised our external validity or generalizability to other similar study populations. And then finally, we followed very rigorous analytical practice to conduct all of our meta-analyses. Now, perhaps the most surprising, not that I was surprised really with the findings, but the surprising aspect for me as an epidemiologist who has done a great deal of meta-analyses on foods and chronic disease outcomes are really the limited number of studies. Again, we're talking about a very omnipresent type of dietary exposure, and that is eggs. And we're talking about the largest global burden of disease, at least in North America, and that's heart disease. Yet, we only had 7 independent studies for stroke and some of the same overlapping, but 7 independent studies for coronary heart disease as well. And these are cohort studies. So, for example, in a topic like red meat and colorectal cancer, we have well over 30 cohort studies. So that I think this is what surprised me the most, is that we had fewer studies. They are continuing to be published, and we'll appraise the literature as we go. But they are published in a wide variety of study countries over about 32 years. As we looked at studies up to, I think, 2015. There have been a couple studies since that I talk about later. They are a robust set of studies. They were able to follow people from 6 years to 26 years of follow-up. Most of the studies did adjust for relevant factors such as age, gender, body mass index, physical activity, and so on. So what did we find? Well, here are the 7 studies for stroke. There's a few more data points because some of the studies stratified or reported data separately for men and women. Now, this is a forest plot illustration of a meta-analysis. So if there's no difference between people who consume the most eggs and people who don't consume or consume the fewest number of eggs, that relative risk is 1.0 with 1, the line in the middle. So if we find that people who consume the most eggs have a decreased risk, that those estimates are on the left of 1, and then of course an increased risk on the right. These circles represent the relative risk estimate in the study. The size of the circle indicates how large the study is, or the influence, or how precise that association is. And the horizontal lines represent the 95% confidence intervals, the variability or the range in values. So when we just taking a look at this, you can see that most studies actually do report a decreased risk for stroke. Now, when we put all the data together, we get the diamond at the bottom, which is the summary relative risk estimate. And that corresponds to SRRE of 0.88. What that means is there's a 12% reduction in risk of stroke among the highest versus the lowest egg consumers, which is generally up to about 1 egg per day versus no to very little egg consumption. So we did see a 12% reduction in risk. Now, when we conducted our stratified and subgroup analyses, you can see here, so I'd like to draw your attention to the column that says SRRE, that's our summary relative risk estimate. And you can see all the studies for total stroke, those 7 studies, and then all the different subgroup stratifications that have relevant data for these other iterations. Now, again, we were only starting with 7 studies. We do have a pretty robust data set, but there are some limitations for our ability to conduct different subgroup evaluations. But what you'll see for the summary relative risk estimates, all of them are pretty close to each other, meaning there's no effect modification. And really what that means is based on the factors that we're able to take a look at, none of the individual factors really dictated the direction of the association. So the findings are robust. We do have a lot of confidence in those findings. It's a homogeneous group of studies, as indicated by the p-value for heterogeneity, which tells us whether or not there's some statistical variability between the studies. Now, what's really interesting here is the dose response, or perhaps lack thereof. So on this slide, this is called a meta-regression plot. And so you can see at the bottom on the x-axis, this is egg intake per week. And as you increase your egg intake, you can see the direction and magnitude of the results. There's a line going across the middle, that's called the regression line. And the circles are the actual relative risk estimates. The larger ones are the ones that carry the most weight in the model. But really what's interesting here is for disease causation, you really look for a monotonic increase or decrease, meaning that when you increase your level of consumption, you have a corresponding either increase or decrease in that risk. Here it's flat. So what this says is all egg consumers have a decreased risk of stroke. And so we don't have a lot of information on different patterns of association by increasing or decreasing your level of egg consumption per week. So there may be other things at play that are driving this, or it's just eggs are beneficial at all levels, or there's some issues with dose response, and there's, again, some other kind of confounding factors working on this. So it's something that, again, we need some more studies to really fully be able to articulate and delineate what we're seeing here in terms of dose response. Okay, now when it comes to coronary heart disease, again, just looking at this plot, you can see that most of the studies are below 1.0. Most do show a decreased risk. However, given the variability of the data, when we put all of the evidence together, we see a slightly inverse, a 0.97 summary relative risk estimate. That means a 3% decreased risk, but it is not statistically significant. But again, most of the studies are below 1.0, but what it says is there's no evidence of an increased risk of coronary heart disease based on high versus low egg intake, but there's not really clear evidence of a decreased risk either. Okay, now when we looked at the different subgroups as well, we have our 7 studies. We have limited numbers in some of the subgroups that we're able to explore. We don't have appreciable effect modification looking down that column for the risk estimates. We do have some more variability though compared to stroke, but nothing really impactful. But I do want to draw your attention to the findings by gender. So for men, we had 4 studies, summary relative risk of 0.98, that's not significant. But for women, we only had 3 studies here, but we found a 0.81 for coronary heart disease. So we found a 19% decreased risk of disease that was not statistically significant. So there's more on that. I think there's some reasons behind that, which I'll talk about here soon. Now, when it comes to dose response, again, we really don't see any clear patterns of dose response. We have our regression line pretty horizontal going across. There's really no increase or decrease there. So universally, it's all egg intake appears to be associated with a very slight, null to slight decreased risk of coronary heart disease with no patterns of dose response. But again, I think other factors are at play here. There may be differences by gender. I think there's differences in risk profile among egg consumers, which we'll talk about soon. So based on this analysis, what are we seeing here? That up to 1 egg per day may be associated with reducing the risk of stroke, up to about a 12% reduction. However, we do have to consider the fact that we did lack a monotonic dose response pattern, meaning that the amount of egg consumed didn't really impact the relative risk. And so we do need some more studies that really delineate the intake levels so we can solidify our conclusions more and explore whether there are any dose response patterns that may be at play. Now, when it comes to coronary heart disease, we found that egg intake was not associated with risk of CHD, most definitely not associated with increasing the risk. Maybe a slight reduction in risk, however, the evidence isn't clear yet. But most studies do report a decreased risk. No evidence of a dose response relationship again, so we need some more studies to fully articulate that evaluation. And we did find some indication of a decreased risk among women based on few studies. Okay, now there has been some evidence though, however, that egg intake is associated with an increase in cardiovascular disease risk among diabetics. The exact mechanism, at least as far as I know, is unclear, but we do have some evidence looking at that. Now, when we consider the state of the science, however, on this topic, we do see a lot of variability by specific cardiovascular disease endpoint, and it varies by study. One study may show something for stroke or cerebrovascular disease. Another study may show something for coronary heart disease. So there's variability there. We also have smaller analytical sample sizes. Fewer people have existing diabetes that have been evaluated for egg intake. But importantly, and perhaps the most important thing here is that people change their dietary and lifestyle behaviors as a result of being diagnosed with diabetes or symptomatically as well. So the studies really have not done a great job of capturing some of these changes in dietary and lifestyle behavior. So there's some issues with bias and misclassification that I don't have a lot of confidence in any of the studies that do show an increased risk of cardiovascular disease among diabetics who consume eggs. And that's kind of further supported here. So we have a new study out, or that's coming out, I believe, where they did find some non-significant, slight, modest elevations for among diabetes and cardiovascular disease. However, it was pretty inconsistent and led the authors to conclude that low to moderate egg consumption was not associated with an increased risk of CVD risk in diabetic or non-diabetic individuals at high cardiovascular disease risk. So there's nothing really going on here that further supports that theory or hypothesis. We have another study in Swedish men and women that really discount that potential diabetes hypothesis. And so if you could take a look to the right where it says greater or equal than 1 per day, so that's 1 or more eggs per day. And so this is stratified by patients with and without diabetes. So what you're looking at here is to see if there's a difference in the risk estimates by those who have and who do not have diabetes. So for heart failure, you'll see 1.23. Now that is elevated, so that's a separate story, but it's not statistically significant. There's no pattern of dose response. What I'm interested in here is looking at those with and without diabetes, 1.23 for both. Diabetes does not modify the association. When we look at myocardial infarction below, it's 1.01 and 0.95. No evidence of an increased risk. Both of those are pretty similar. No evidence of effect modification either. And then when it comes down to stroke, ischemic stroke at the bottom, for the highest consumers there, we see more of those similar patterns of an inverse relationship or decreased risk, but there's no significant effect modification across the board. So overall, based on the current state of the science, I think any kind of positive observations with egg intake and cardiovascular disease risk among diabetics is really due to methodological issues and limitations, and the overall state of the science is not supportive of an adverse outcome there. Okay, so our evaluation, when our paper came out, it did receive some attention, more attention in Europe. There's some media and some other things going on with it, of course, because again, you have such a ubiquitous exposure, common dietary factor with any kind of cardiovascular disease endpoint. So in this particular example, similar conclusions. I at the bottom there, I really say that we need some more studies, though. We need to look at additional studies that focus on intake levels. And so we have to get a clear understanding if there is any kind of dose-response relationship going on, because the current state of the science isn't showing anything consistent with any kind of clear pattern of dose response. And I think that would be really informative as we move on. So we need more studies, and we need more studies with clear intake categories that allow us to conduct such analyses. So I'll continually be appraising the literature as studies come out. I'll be updating the meta-analysis and really taking a look at the data a little bit more closely, and hopefully working on some subgroup stratifications as well. So they say, give an epidemiologist a database, they'll give you whatever answer you want. Of course, I don't do that. We follow a very transparent methodological process when we conduct our analyses. But Dr. Spence took. He wasn't a major fan of what we did. So he said, well, the study is partially funded by the Ag Nutrition Center. Well, yes, it was. But again, we followed, we used peer-reviewed, publicly available data to conduct our analyses in a very transparent fashion. If he wants to talk about the data, I would be more than happy to talk about the data with him. But really struck me as he talked about reverse causality here and said that people may change their dietary habits after diagnosis, or they may not, which is fine. However, that's not an issue for us because we looked at prospective cohort studies looking more at that cause and effect relationship. So that's really a non-issue here. Okay, so we have some very kind of the foregoing challenges of dietary assessment. Egg consumption and cardiovascular disease is no different. Individual food items and food patterns can really be difficult to recall. They may vary temporarily. There's exposure misclassification prevalent throughout nutritional epidemiology. We may have some differences in portion size, cooking method as well. Eggs are used in many different types of dishes and food compositions. So there may be some maybe underreporting if people are consuming eggs and they're not aware of it, or it's not being captured on a food frequency questionnaire. Differences in culture are relevant, and we have some different patterns of intake levels by different types of consumers within the U.S. and in North America and other countries as well. And so really, though, disease risk is modified by the way people live their lives. And I think that's something that in the world of nutritional epidemiology, we have to start asking why a little bit more. So we continue to see these same studies over and over again that show results, but we really need to understand why. We really need to understand the consumer and the behaviors of the consumer. I'm not just talking about the dietary behaviors, but the lifestyle activities as well, physical activity, body mass index, smoking, alcohol, even clinical parameters, socioeconomic status. So we have to consider the consumer. In nutritional epidemiology, it's extremely relevant because everything is so highly correlated. So in a typical food frequency questionnaire, it may say on average over the past week, month, or year, how frequently do you consume X, Y, or Z? And so for eggs, which obviously I added here on the image, eggs shows up on these food frequency questionnaires. So we're looking at these two different images here, and I just selected these because they look a little different to me, but we may have different types of consumers. So if we're reporting this on a food frequency questionnaire, eggs are eggs. It's listed the same. However, we may have a different type of consumer who preferentially selects the image at the top, versus the image at the bottom. I'm not judging either. Both look delicious to me. However, there may be a different type of consumer. So we have to be aware of that and consider that when we conduct the studies and when we interpret our research findings. So in the world of nutritional epidemiology, everything is so tightly correlated and the results are close to the null value. So for smoking and lung cancer, we may see relative risk of 10 to 12 to 20. For nutritional epidemiology, we're talking 0.8 to 1.25, sometimes an order of magnitude or more below other areas. So it's really difficult to disentangle the effects of a single food and to independently isolate the effects of a single food on chronic disease risk. That's why it's really important to understand these different intake categories and the behaviors of the individuals who are reporting their food intake levels. Okay, so just a preliminary evaluation of kind of behaviors and differences. Taking a look at the actual studies that gave rise to the relative risk estimates, we see that among men who consume the most eggs, they tend to smoke more than men who consume fewer eggs. No real change in vitamin use, which may be a surrogate for health status and health awareness. And men who consume the most eggs, again, at least in the studies that gave rise to these relative risk estimates, have lower physical activity levels and lower education, at least in the US studies. Now, in contrast, women who consume the most eggs smoke less than women who consume the fewest number of eggs. And they have a higher vitamin use. They are more physically active. They do have a lower education, at least in the US. But again, we saw a 19% decreased risk in coronary heart disease. Maybe it's the health status of the consumer. Maybe it's other behaviors as well that can play a role into that, where eggs fit into this healthy kind of dietary pattern. So as we move forward in nutritional epidemiology, I'm really interested in the modification of these different factors. So one is we need more studies for sure, because we need to be able to evaluate with more precision the state of the science in these risk estimates. We need more studies with clear intake levels so we can look at different patterns of risk and if they change by a level of intake and dose response. And we need to be cognizant of the fact that people have different behaviors. So what do we see for egg intake among people who are more physically active versus those who are physically inactive, or who may smoke or not smoke, or diabetes versus not diabetes status? And so we really need to kind of evolve the science and the way of thinking in nutritional epidemiology as a whole. And also when we look at eggs as well, we really need some more studies to make some informed conclusions. So thank you.
Thanks very much, Dominik, for your presentation. You've given us a lot to think about. And I just want to take a minute to remind our participants that if you have any questions coming out of Dominik's presentation, feel free to use that chat box that's at the top of your screen and to type your question in there. We'll try to make sure we can cover all of our questions up after we get to our next speaker. So our next speaker is Kim Kessler, and she is the Nutrition Officer with Egg Farmers of Canada. As EFC's resident registered dietitian, Kim works on marketing and nutrition resources for consumers and stakeholders across the country to help everyone understand the nutritional benefits of eating eggs. We're delighted that she can join us to talk about the practical applications of this research. So go ahead, Kim.
Thanks very much, Karen, and thank you very much, Dr. Alexander, for being with us this morning and for taking us through your research. I personally always enjoy hearing the results straight from the source and hearing a bit more context around it, as it helps us kind of figure out how to then talk about it to our various stakeholders and audiences. So we appreciate that very much. I won't take too much of your time. I just wanted to touch on some of the work that we've done in this area with health professional audiences and give you a sense for what we've noticed over the years in terms of perceptions of health professionals when it comes to cholesterol and eggs. So for those of you on the line who may not know this, for several years, Egg Farmers of Canada worked very diligently to, I guess, debunk this myth about cholesterol in eggs, as we knew that it was a big issue with family physicians in particular, where they were limiting egg consumption for their patients. And so we really wanted to talk to them and bring to light, you know, the science that we knew of at the time, that really showed that dietary cholesterol doesn't really affect blood cholesterol and heart disease risk. And so much of that work was done through our physician education program, which involved various representatives across the country who went to talk to doctors like a pharmaceutical company would, and sit down with them and talk to them one-on-one and take them through the research at the time that existed. So this is stuff like the Harvard Egg Study and similar research that came not long after that. And so over time, I mean, we've been tracking physician perceptions and attitudes on this subject, and we started 65% of family doctors in the country in Canada told us that they were limiting their patients' egg consumption, and several years later, after we concluded this program, that number was down to about 25%. And so we've seen over the years that the concern is not what it used to be. Obviously the shift in some of the dietary guidance globally has also helped us with this along the way. But it's just, even if we've improved kind of the notion up here on this topic, it's really nice when we can get sort of more robust analyses like Dr. Alexander's that looked at a big body of evidence and included newer studies and studies that also looked at egg consumption specifically to kind of help us reaffirm that message as we continue to communicate with our health professional audiences. And even then, today, I still get questions from dietitians in practice, saying that they get questions from their patients about, and they know that eggs are nutrient dense and have all these benefits, and they still want to know, how many eggs can I tell them they can eat, and how many, what's the science saying these days? And, to Dr. Alexander's point, it's not that black and white, and we don't have a magic number. And it's important to understand the context of the science and be able to explain the results in terms of risk estimates and things like that. Again, the notion of patients with diabetes is an important one, and one that, is still quite gray. And, again, I get asked this a lot by our colleagues in the provinces who talk to people at various shows and whatnot. What do I tell people about diabetes? And I think what Dr. Alexander explained was important about, the existing studies and some of the issues that exist there in terms of methodology. And so we can't say that eggs, cause a higher risk for patients with diabetes. And it's important to know that there are newer studies being conducted right now, emerging studies, that are better designed and that are showing differently. And so that we're trying to figure that out. Something else that's important to note, up here, Health Canada hasn't had a limit on dietary cholesterol for many years, but there was quite a bit of influence from the American guidelines. The 300 milligram limit still impacted the way that, health professionals practiced here and some of the advice that they gave their patients. No offense to our American colleagues on the on the phone, but, unfortunately, we had to kind of deal with that. And to this day, even resources like Dietitians of Canada's PEN, which is their practice resource, they still, a lot of the guidance that they provide still take into account some of that old American guidance. And so it's unfortunate that when, practitioners go and look for advice on what to say to their patients, the information that's provided is out of date. And so, I think it's important for everybody to stay on top of research like this, as it does take a while sometimes for the guidance to catch up with the science. And that's why we feel, as an industry, that it's important to keep contributing to grant programs like the Egg Nutrition Centers that fund research like this. And, that we're able to share the results with you via tools like this webinar and some fact sheets that we'll be developing as well. So I think that's about it for me. I look forward to your questions. I hope you've been jotting them down. And I'd like to once again thank Dr. Alexander for his talk.
Thanks, Kim. As Kim mentioned, we've had a very full set of presentations, and we're sure that you all have questions. So again, if you have a question for Dominik or for Kim, please submit your questions using the chat box icon at the top of your screen. And you can just type your question in there. So as folks start to type their questions in, we've got a couple questions here in the office. And just to start things off, Dr. Alexander, you had talked a little bit at the end of your presentation around what other studies could come out of this research that you've done, or what are those research gaps that we're looking at? And I'm wondering if you could just elaborate a little bit more on what role these new studies could play and how they could be useful.
Right. So as I indicated before, I think that my biggest surprise was the relatively, when I say relatively, that means eggs are a very common exposure. Cardiovascular disease is the most common outcome. So there's a relatively limited number of studies published over the past 35 years looking at the risk of egg intake and these outcomes, despite the fact that cholesterol has received all this attention over several decades. So that struck me as really surprising. So what we need really are a more robust set of prospective cohort studies. We need more studies that are conducted in different study populations around the world that really take into account the level of intake, how many eggs people are actually consuming, and very transparently report those intake levels with relative risk estimates, while accounting for other behavioral and lifestyle characteristics. And I think at that point, then we can start to solidify our conclusions. Right now, we are seeing evidence of either no association for coronary heart disease or some evidence of a decreased risk for stroke. I think at this point, we can clearly say that eggs do not increase the risk of those outcomes. But I think we would like to get to the point where perhaps we can say, well, maybe eggs decrease the risk of some of these outcomes in at least certain subpopulations. We're not there yet. We need some more data, and then we'll continue to appraise the evidence and continue to conduct these meta-analyses, looking to see if there truly is a decreased risk of stroke, and if there truly is, for example, a decreased risk of coronary heart disease among women or some other study populations.
Great, thank you. Now, Kim had also talked a little bit about how the research can be concretely applied, and I'm wondering if you see any other ways that this research could be put to use, keeping in mind that sometimes there are those detractors out there who might not be supportive of the research and that sort of thing. But do you see space for this research having a bit further use in terms of extension?
I think so. I mean, just like science in general, it's an evolution, and I think this adds to the evolution in our understanding of this topic area. I think the good news here is that clearly egg intake is not associated with any of these adverse outcomes. Eggs again are a nutrient-dense whole food that can provide other health benefits as well, and clearly fit into a very broad beneficial dietary and lifestyle pattern that can reach international populations. And so I think that the messages are promising here for eggs. I think that we continue to get answers as more research is published. But I think our work will then evolve into other researchers and work in this area, and we'll continue to update this as well. But I think as it stands, the news is quite favorable.
Thanks. Kim, just kind of building on what Dr. Alexander was talking about in terms of the research gaps that are out there and how the studies could be used. From your perspective, do you see similar research gaps, and what kind of information could those new studies provide?
Yeah, I mean, the whole notion of getting at dose response and figuring out if there's a difference in the effect of eggs depending on how many you eat. That's the question that we get all the time and that we frankly can't answer. It goes back to what's that magic number. because as we know, there's, when it comes to nutrition, there's so many other things that are at play, like lifestyle factors and pre-existing conditions and all of that. So, the more we can get at that and answer those questions, I think the better off we'll be. The whole, the people with diabetes group, that's a tricky one as well. Again, a lot going on with them metabolically. And so, trying to isolate exactly, what foods have what kinds of effects in people like that is tricky. But, obviously answers that we'd love to have as well. So I would agree that those are two areas that we really need to get more info on.
Great. Now we have a question from one of our participants, which I'll just read out now. And maybe Dominik and Kim, you can both respond. As a 20-plus year dietitian advisor to the Egg Nutrition Center, I'm perplexed by a few esteemed researchers in the U.S. who still cling to the idea that dietary cholesterol is a risk factor for elevated blood cholesterol and heart disease. Why do you think that is? Dominik, do you want to take a stab at that one?
In terms of why, I think that's probably, let's see here. This is being recorded, right? So I'm trying to use my words carefully and not come off as too snarky. Of course, some researchers are, I'll give kind of more of a non-scientific answer. I'll let Kim answer the scientific part of it. Some researchers are set in their ways. If they've published, they've shown something over the years that they believe to be true, there's a reluctancy to either admit that you're wrong or to understand the shifting state of the science as it evolves. And I think that's been one of the big problems in nutritional epidemiology in general when we look at many different dietary factors. I mean, cholesterol is a great example where what we know now is not what we thought we knew. I think there's a political landscape obviously going on, but I think it's just kind of the reluctancy to accept the changing dynamics and the scientific landscape as well. So that's kind of my non-scientific response. I'll let Kim respond scientifically.
No, I don't think I have anything to add on that one. I would have had a very similar answer.
Yeah, and it speaks to the complexity of the research and also, what space the research is taking place in and how that can really affect people's attitudes. Now, as we just wait on, we've got a few more minutes for questions to come in. So if folks still have questions, feel free to enter them in that chat box. Dominik, just another question for you. I know that we asked you to present within 25 minutes, which isn't very much time. So I'm curious if there's anything else that you wanted to speak to or anything that you didn't get a chance to elaborate on as part of your presentation that you wanted to speak to now.
Let's see here. So I think for me, it really kind of goes back to that the process, the continuous appraisal, which is this meta-analysis process. And when I discussed dose response and some of the variability, what we're doing really is taking a look at what's reported within each study in terms of the level of intake. And so we're trying to analytically model those data. So if a study reports on different levels of egg intake, and it may be one a day, it may be 3 per week, there's different categories. So what we do is analytically, we do our best to try and make sense of those intake data to come up with the best dose response model that we can. And so that's what you saw in those kind of messy diagrams, those meta regression plots. But again, I think really it goes back to what can we say? We said that magic number of eggs. I don't think there is one right now, but I think we can safely consume eggs and not have to worry about stroke or coronary heart disease. And then as this science evolves, as we get some more data, then epidemiologists and others such as myself, then we can say, okay, this is where we're at. This is the kind of risk reduction, hopefully, that we can see with eating this level of eggs. Now, Also, when it comes to kind of profiling the egg consumer, there's a great deal of within and between person variability in the way that people live their lives. And so it's not so much a dietary patterns issue, which is that's kind of the foundation of it, but there's a lot of within and interperson variability in the type of consumer out there. And I think I had a slide that talked a little bit about men and women, and so I do find it interesting that men who consume the most eggs do engage in some unhealthier dietary and lifestyle factors, whereas women who consume the most eggs engage in healthful dietary and lifestyle factors. So I think that's something that we really need to explore further as well.
Great, thank you. Now, if we don't have, it doesn't look like we have any other questions coming in through our chat box, so I think we'll take this opportunity to wrap up. And I just want to say a big thank you to everyone. This has been a really great webinar. In particular, I'd like to thank Dominik and Kim for presenting to us today, and also to you, our participants from all across the country, for joining us. I just wanted to note that we'll be having other webinars coming up over the next few months. And if you head over to the EFC website, eggfarmers.ca, you can sign up for EFC's newsletter. And our newsletter will keep you up to date about any upcoming webinars and events that we have going on. We have been recording today's session, and we will share the link with all of you once it is up in case you'd like to share today's presentation with your colleagues. And again, please contact us if you have any questions at any time. You can email us at cpa@eggs.ca with any questions that you might have. So thank you for joining us, and have a great rest of your day.